So good morning, good afternoon, good evening to everybody. I'm very happy to present today webinar. I'm Monica Bomba. I'm a psychoanalyst at the Italian Psychoanalytic Society, and I take part at the IPA Communication Committee. So today's panel is titled Hope and Rebirth, Psychoanalytic Reflections on Generation Z. And we have three colleagues, three psychoanalysts from the three regions, Darius Leskauskas, Sumru Tufekcioglu, and Olga Santamaria, who will present their papers in this order. So the three authors will present their theoretical reflections on Generation Z, which is the actual generation of adolescents, and they will discuss the impact that global changes, internet, social media, and technologies may have had on adolescents today. So as always, as psychoanalysts of adolescents, we are invited in the kaleidoscopic adolescent world to get to know it better, to develop new ways for taking care of these new forms of sufferings, but also to be able to recognize new resources and strengths. So I will tell you now how the panel will be. So the presentation of the three authors will last about 1 hour with the discussion. And then the next half hour will be for the Q&A. And you will have to write your questions on the questions pane on the right-hand side of your screen. So now I will present you the first panelist, Darius Leskauskas, who will present his paper titled Generation Z, Everyday Living with an Auxiliary Ego. So he is a medical doctor, PhD and professor in psychiatric clinic of Lithuanian University of Health Sciences, head of postdoctoral studies in psychotherapy in Luz, and he spent 20 years practicing as a child and adolescent psychiatrist and psychoanalytic psychotherapist. His main scientific fields of interest are personality development in adolescents, anorexia nervosa, suicidal behavior, and psychotic breakdown in adolescents and adulthood. For his competence in these fields, Darius is consultant for the Lithuanian Ministry of Health. He is also member of the Executive Committee of the International Federation of Psychoanalytic Societies and co-author of a textbook titled Psychodynamic Psychiatry in 2016. So please, Darius, go ahead.
Thank you. I'm very happy to be invited to this webinar on Generation Z. It is the generation of my youngest daughter and half of my patients. So I have a lot of direct personal and professional encounter with it and curiosity to understand it better. Let me share some personal observations and reflections. If we talk about Generation Z, it means we consider that children born in 21st century have certain universal differences from those who were born before. And these differences should be influenced by some universal changes that took place in the world during this development. My main idea is that very early exposure to informational technologies is the main change shaping the differences in the development of this generation. Smartphone becomes an important developmental object for an infant from the very first year and follow all the life, influencing different aspects of personal and interpersonal development. It takes different roles, but the main is of the ever-present auxiliary ego. This influence is determined by the characteristics of new technologies and by the changes in parenting patterns embracing these technologies. Psychosocial development of parents of Generation Z was paralleled with accelerating development of the new personal computers and internet technologies, which were finally integrated in the smartphones. They have integrated the use of this equipment into all areas of their everyday living, including parenting. Lullabies for their children come from iTunes, and fairy tales are transformed into animation series. They introduce new technologies to their babies as important objects. Working in a hospital, I can often see mothers offering smartphones to their babies as young as 6 months old to calm them down after a frightening procedure or simply to get some time for themselves. In this way, smartphone is introduced into their early interactions and used by this attachment couple for emotional regulation, resolution of their interpersonal and intrapsychic conflicts. It looks like smartphones are assigned by the mothers the role of their substitute, a kind of transitional object, and babies accept it. They turn to it for the comfort when distressed. It has human characteristics, sounds of human voice, pictures of human images, and it is seductively stimulating. Increasing time spent with smartphone increases the chances or risks for it to become an addiction or attachment object. The prevalence of smartphone addictions had increased so drastically, especially after COVID-related lockdowns, that it makes me doubt if it should still be considered pathology, if addiction or attachment to smartphone is characteristic to a better part of Generation Z. It is inextricably integrated into everyday living and development of this generation. The question is, how do new technologies function in these processes? I presume that the meaning and function of smartphone changes with the age and needs of a developing child. Early in life, it can take the role of attachment and transitional object, also helping in separation from mother. Later in preschool and latent years, it is extensively used as the ground for play and new skills training. With the onset of adolescence, smartphone is increasingly used for social communication and identity formation. Smartphone follows the child of Generation Z in every step of their development, and it participates in the resolution of the main psychosocial crisis and emergence of such virtues as autonomy, competency, narcissism, and identity formation. It can be seen as everyday ego assistant and auxiliary ego. The notion of auxiliary ego was presented by Rudolf Lowenstein, later expanded by Maxwell Gittleson, who considered that the analyst operates as an auxiliary to the patient's ego, with its own intrinsic potentiality for reality testing, synthesis, and adaptation. In other words, the role of the analyst as an auxiliary ego is one of an external object, which can be used by the patient as a help for his malfunctioning internal ego. In 1960, Jean Lampal de Groot was probably the first to write about the role of auxiliary ego in a normal adolescent development. Quoting her, the little child's ego, undeveloped as it is, has to rely upon the auxiliary ego borrowed from the mother in order to master outer and inner conflicts. The adolescent ego has many more ways and means of coping with the drives. In certain sense, we could call his ego stronger. However, on the other hand, it lacks the support of the parent's auxiliary ego because the adolescent turns away from the parents. In this respect, the adolescent ego presents itself as much weaker than a child's ego. In this vulnerable developmental period, adolescents need a substitute for the lost parental auxiliary ego. Adolescents tend to turn for this substitution towards peer groups, but friends are not always available or reliable, especially if you have social fears or incompetences. There, smartphone comes in as an ideal new auxiliary ego for the adolescent. The device has all the characteristics necessary for the adolescent's auxiliary ego. It is wise, With it, you can be constantly connected to the World Wide Web, which contains all the wisdom of humanity. It is reliable. It stores and recalls your memories in photos, videos, chats. You can access it whenever you need it, and it keeps confidentiality. At least adolescents believe in this. The device helps to test reality by providing answers to any questions, even to questions like asked by one of my patients. Is it true? What does it really mean? Smartphone helps to solve interpersonal conflicts. You can express your anger by blocking a person on your social media, or you can post a remorse message if you want to apologize. It also helps in solving inner conflicts. You can get the suggestion how to act or react in any situation by turning to Google or influencers. It helps in affect regulation and impulse control. You can act out your aggressive and sexual impulses in online games, social networks and media, porno sites, and in many other ways. You can create your virtual identity or profile in social media or online games and compensate for all your narcissistic disappointments in reality. There you can find all kinds of self-objects needed for your narcissistic exhibitionistic omnipotence, idealization, and alter ego. It is powerful and rich. It has and gives anything adolescent needs. These are just some examples of the use of new technologies as an auxiliary ego for the development and needs of adolescents. Much more could be told about conflict-free ego functions delegated to new technologies. Getting and processing information, solving tests and problems, learning new skills, and many, many more. Artificial intellect of smartphones, software, shows interest in you, which can be perceived as more genuine and not so persecuting or controlling, like it happens with some parents. It cares about you, suggests you tracks or movies adapting to your previous choices. It tells you how much physical activity you need today, gives you inspiration for meditation, and much more. I think this contributes to the formation of pseudo-maturity, or pseudo-maturity without denial of dependency needs, described by Viviane Monjac as important characteristic in Generation Z. New technologies have another characteristic that is crucially important for adolescents' narcissism. They help to deal with their needs without causing narcissistic conflict about being dependent on the help of adult persons, which can arise when getting help from the parents or from the analyst. A teenager feels he or she owns this auxiliary ego with all its powers. With its incorporation, the adolescent can even feel superior to the parents and other authority figures. In that way, it helps to succeed in the secondary Oedipal conflict re-experienced in adolescence. I think that nowadays Oedipal conflict is often displaced on the conflicts with parents about the hours spent on the internet. The object had been changed. These days, Oedipal fight is about who owns the internet with all its attractiveness and powers. Is it good or bad to have such everyday auxiliary ego? I think that, as always, a coin has two sides. On one side, as other auxiliary egos, this one should improve ego functioning of a child and adolescent. On the other side, it can leave them dependent on it and helpless without it. Probably it is important how benign is such auxiliary ego and permanent attachment to internet, which, as we already see from our experience, contains much good and bad things in it. I think that balancing and guiding by traditional auxiliary ego of parenting figures increases the chances of positive gains. And what about us, professionals who work with adolescents? All articles I found 2 years ago in PepWeb on Generation Y and Z shared two characteristics. All they mentioned the role of new informational technologies, and all they focused on the threats posed by new technologies for the development and mental health of young generations. It seems like we are opposed to and afraid of them. But why? Is it because in our clinical work, we deal with the most disadvantaged cases and are accustomed to focusing on the problematic aspects of psychological functioning? But do new technologies increase the risk of new pathologies for everyone? Or are they just giving new forms of the known pathology for the vulnerable persons? Or maybe we feel angry and see smartphones as our rivals for the patient's auxiliary ego position, especially when we see them holding their phones all session long and showing more interest in those phones than in us. Or maybe ourselves, we feel more and more dependent on our smartphones, more perplexed by new technologies and less competent with them than our adolescent patients. But maybe the younger generation is more competent to assimilate new technologies productively, to take the advantages of having such a powerful auxiliary ego constantly at their reach. Maybe they have potential to develop immunity to the pathogenic influences of new technologies. Probably it is one of our tasks bringing up children of Generation Z or when having them in the analysis. To help them achieve this, we have to maintain our position of alternative auxiliary egos. Alternative not just to parental figures, but also to the smartphones of our young patients. To be accepted by our patients, we need to accept the importance of our rival, smartphone, for them. And to be able to survive in these triadic relationships. Our advantages are the same as always: genuine interest and competence in understanding their inner and interpersonal world and their human suffering. I think that there we can always be better than artificial intellect. Thank you for attention.
Thank you, Darius. Now I will present Sumru Tufekcioglu. She will present her paper titled The Millennial Turn, an Emerging Domain in Problems in Living. Sumru is a clinical psychologist, psychoanalyst, and a faculty member and supervisor at the William Alanson White Institute in New York City. And she is on the Mount Sinai Morningside and West Hospital faculty in the psychiatry residency program, where she received the 2019 Teacher of the Year award. Additionally, she serves as an executive editor of the Contemporary Psychoanalysis and as a president of the Candidates Council of the APSA, American Psychoanalytic Association. Dr. Tufekcioglu has authored articles and book chapters on personality disorders, trauma, therapeutic alliance, case formulation, therapy, self-disclosure, millennial culture, and psychoanalysis. Her interests include psychotherapy integration, interpersonal and relational psychoanalysis, and supervision and training aimed at helping trainees develop their style in psychotherapy. Dr. Tufekcioglu is in full-time private practice in New York City. So, please, Sumru, go ahead. Thank you.
Thank you, Monica, and thank you for the invitation to participate in this discussion. It's a pleasure for me to be here. In the interest of time, I'll present a shortened version of a paper I wrote published in 2019 in Psychoanalytic Quarterly. Cultural changes that take place over time lead to shifts in our understanding of psychopathology, which then lead to revisions in our theories and techniques of psychotherapy and psychoanalysis. In what follows, I explore how I think we need to revisit our analytic formulation of the patient as a new generation of people, namely the millennial generation and Generation Z that follows, come of age and soon become the majority of our patients and analytic candidates. Due to the seismic shifts in the culture that took place during their childhood years, first millennials, then Gen Z, grew up with life experiences that were vastly different from the previous generations, and they were shaped by those experiences. I'll discuss how these unique experiences led to different characteristics and problems in living for these two generations, and accordingly what they need most from analytic treatment. The notion that models of psychoanalytic theory change as paradigms shift over time due to changes taking place in the culture was introduced to the psychoanalytic literature by Edgar Levinson in 1972. Levinson believes that innovations in technology have led to shifts in cultural paradigms, and that as man developed new tools, he in turn was shaped by the tools he created. The internet is a good example of this, I think. It has shaped how we live. Levinson further explores how paradigms change over time, so do our formulations of the patient. He writes, and I'm quoting here, "When we attempt to review a case of Freud's, it is very dated and unfamiliar to us. We cannot see the hysterical young girl through Freud's eyes. The diagnosis of hysteria means something different now." End quote. Similarly, another psychoanalytic theorist, Steve Mitchell, explores in his book, Hope and Dread in Psychoanalysis, how in his understanding what the contemporary patient of his time, which was roughly 1980s, how his contemporary patient needed from the analyst had shifted significantly from what Freud's typical patient needed in treatment. Mitchell observes that the primary problems in living had shifted since Freud's time, and that his patients were coming to therapy not only due to disturbing symptoms, but more because they were missing a sense of personal meaning in their lives. Mitchell writes, quote, "Freud's typical patient was the man or woman otherwise adapted to his or her culture and historical time, except for the intrusion of unwanted, often bizarre symptomatology, such as the rat man's obsessive fantasies and Dora's hysterical cough. The typical patient in today's psychoanalytic case descriptions is a man or woman, often without bizarre symptoms, whose very adaptation to his or her culture and historical time is regarded as the problem, not the solution." End quote. In my view, similar to the shift that occurred from the 20s to the 80s, from Freud's patients to Mitchell's patients, who were inevitably a product of their particular time and cultural field, we are now at another turn in history that demonstrates a shift in problems in living, which millennial and Gen Z patients are faced with. I'll explain this in more detail in a minute, but first let's review some of the typical characteristics of the millennial generation. Here, I'd like to acknowledge that there are differences between the typical characteristics of millennials and Gen Z. However, the cultural shift I'm examining here has started with the millennials and continues in a more pronounced way with Gen Z. Therefore, I believe a closer look at the millennials will be helpful here. Millennials grew up in the information age and have a natural comfort with digital technologies and social media, just like Gen Z. This is a well-known fact. But when we look closely, it becomes clear that millennials grew up in a world that offered some fundamental experiences, life experiences, that simply did not exist in the world in which the preceding generations grew up. For example, the generation immediately before the millennials, Generation X, which happens to be my generation, can remember a time when computers hadn't yet been invented, when there were a limited number of TV channels to choose from, and concepts such as the internet, Facebook, Instagram, or online shopping simply did not exist. More importantly, neither were notions such as gay marriage or non-binary gender preferences a reality of our time growing up. Millennials, on the other hand, were born into a world where all these experiences were natural, just the way things were. Millennials came of age in a world in which the number of channels to watch on TV were not limited to a handful. Instead, one could, with the click of a button, have Netflix make a list based on one's previous preferences. Further, for the typical millennial, the expectation that the world should adapt to me rather than I should adapt to the world is very natural and applies not only to lifestyle choices, but also in more fundamental matters such as gender identity, sexual orientation, ethnic identity, and others. Millennials grew up with greater freedom to explore their identities and to be who they wanted to be. One might choose to be a woman or a man, for example, regardless of one's biological sex, or one might choose not to commit to any gender identity at all, free to call oneself he, she, or they. In my view, the kinds of experiences I have described above, which are greatly different from those of previous generations, represent not just different lifestyles, they also shape who millennials are as people, what problems in living they encounter, and accordingly what they will need from us in analytic treatment. Research findings on millennials have shown that they are outside-the-box thinkers, typically, and have a greater acceptance of non-traditional values and families. Most millennials prefer a flexible work environment and an organizational culture with fewer rules and regulations. In fact, it is expected that as this new generation becomes more senior and takes leadership roles in organizations, the traditional 9-to-5 workday will shift to a more elastic schedule that fits individual needs. Millennials value meaningful work over money or well-paid work and feel strongly about working for organizations that are socially responsible. Think about these findings for a minute. I think it is safe to say that millennials are free thinkers and are set to alter norms. At the same time, the world is moving in norm-altering ways also. For example, technology futurist and writer Jamie Metzl, in his 2019 book titled Hacking Darwin, Genetic Engineering and the Future of Humanity, makes the case that recent developments in genetic engineering, especially advances in genome sequencing, will alter life in significant ways. For instance, with more genetic diseases becoming avoidable, social norms about baby making will change, and more parents will want their children conceived outside the mother so the embryos can be sequenced, selected, and in the more distant future altered. Further, Metzl posits that it will be possible for parents to select the traits they want their children to have, such as height, eye color, or intelligence. He says that over time, natural conception will be seen increasingly as an unnecessary risk when there's a way to control the process. In other words, it's not too much outside the realm of possibility that future generations will be able to, with the click of a few buttons, order a baby according to specific preferences as easily as we can now have Netflix curate for us a list of movies. Clinical implications. I argue that as a result of these cultural changes, a new domain of problems in living is emerging in human life. In my view, for most millennials, the primary problems in living are not limited to symptoms like Freud's patients in the 20s or the search for a sense of personal meaning like Mitchell's patients in the 80s. These problems, of course, will always be part of our work, but for millennials and for others who follow them, such as Gen Z, an additional and major domain of problems in living will have to do with the creation of an external life that suits their unique and dearly valued internal sensibilities and preferences. I call this the creation of the external, which is not a simple task for this generation, because unlike Netflix and unlike their parents who most likely encouraged them to find their own passion, the adult life that millennials launch into does not feel so easy to bend to their needs. It's not uncommon, for example, that after starting a first job, a millennial patient quickly decides that 9 to 5 office work is not desirable. To further complicate matters, it is undeniably true that millennials are inheriting a world from the previous generations with serious macro-level problems such as climate change, endless wars, recessions, and diminishing employment opportunities, which make the external world genuinely difficult to navigate. Compared to Mitchell's typical patient, who is adapted to the structures of his environment but does not feel adequately fulfilled, the millennial patients struggle most in finding a true fit in the outside world, to negotiate with external demands, and to reconcile their needs with the realities of their circumstances. Just as they create music lists to their liking, they want to create an outside world and a life that is truly a good fit for who they are. From my perspective, this is not simply being spoiled or selfish or narcissistic or immature. Rather, it is a genuine struggle. In a new world where there are many more possibilities for how one can live and structure life, with many more options to choose from, it is also more challenging to know how to create the kind of life one desires. In my experience, this is where we see depression and hopelessness in this group of patients. And this is where hope and rebirth can happen in psychoanalysis. In working with a millennial patient, regardless of one's theoretical orientation, I believe that it is important to allow an analytic journey to unfold, in which the analyst can help the patient adjust to the external world while at the same time creating an outside world that fits to his deeply cherished internal values and preferences. The analyst's task here is challenging because the millennial patient's sense of self, outside-the-box thinking, and non-traditional values, in other words, their unique characteristics, need to be protected in the analytic process, I believe, because these are their strengths and their natural ability to shine. At the same time, we need to help the millennial patient find a way to adjust to the external environment that's not so easy to bend to their wishes or to navigate. Creation of the external in analysis requires an active and intensive focus on the external life of the patient, where most of the time the main experiential struggle is, which, as we all know, is not what's emphasized typically in classical analysis. In addition to the intrapsychic and the interpersonal, I argue that we need to incorporate in our vision the external as an additional focus of attention in the analytic process. For the millennial patient, both adjustment to the outside world and a fulfilling lived experience require the creation of the external. Training implications. The millennial candidate. What I have been formulating here applies to training as well. Currently, most of our candidates and trainees are millennials. We don't have Gen Z in training yet for the most part, but we will soon. Millennial trainees value, above all, a training experience in which they can create their own style and find their own voice as clinicians. The millennial trainee, in trying to find his own voice, sometimes gets into trouble with some teachers because he is too outspoken in class and disagrees with the seasoned clinician teacher. The teachers interpreting this as problematic behavior such as resistance, personality issue, grandiosity, or competition with the teacher leave the trainee feeling confused, invalidated, depressed, and hopeless. The millennial trainee struggles in negotiating with the outside world that does not adapt to his own thoughts and theories. From my perspective, again, this is not simply just being difficult or resisting. Rather, the struggle is genuine. It is a frustrating experience to feel one must put aside one's own sensibilities to be able to learn and grow in supervision. Similarly, it is a lonely experience if trusting one's own perspectives and wanting to stay true to one's own views means there will be no supervisor one can learn from. In talking about patients a minute ago, I have suggested that the millennial patient needs help with the creation of the external in analytic treatment. For the millennial candidate, the external, sort of a third in the supervisory process, will be the candidate's own analytic stance based on personal sensibilities. In my view, with millennial candidates in training, both in supervision and didactics, we need to include, more actively than before, a focus on the creation of the candidate's own style. This struggle, experienced by most millennial candidates, have been described beautifully by a senior psychoanalyst, Sandra Buechler. In a letter to her first analytic supervisor, Buechler reflects on how supervision allowed her to stay true to her natural sensibilities and how this was instrumental in her training. She writes, quote, "You didn't make me choose between you and what I believed was right clinically. It wasn't that we never differed, but you just let the difference hang in the air. You seemed to believe that was enough. It was. You didn't seem horrified by my passion. In fact, you didn't seem to believe it would disqualify me. I thought that to become an analyst, I would have to tame and cloak it beneath a veneer of neutrality. You helped me feel that it was an aspect of who I am, something to use rather than something to suppress." End quote. In summary, the seismic changes that are taking place in the culture today have made a diversity of new lifestyles possible. More possibilities for different ways of living make life more complex and make it more challenging to create the kind of life one desires. People of the millennial generation, Gen Z and beyond, will need help with this emerging domain of problems in living. How will psychoanalysis include this new domain in its theories and techniques? This is an attempt at beginning to tackle that question. Thank you.
Okay, thank you very much, Sumru. Now we move on with Olga Santamaria. She will present her paper titled Turbulence in a Generation Crossed by COVID-19, Global Digital Minds, a Psychoanalytic Challenge. Olga Santamaria is a child and adolescent psychoanalyst and training and supervising analyst. She is the president of the Asociación Psychoanalítica de México, PhD at the in clinical psychology at the Universidad Autónoma de Mexico, collaborator of the Ego Psychology entry for Latin America. She has been representing Mexico in FEPAL's Commission of Child and Adolescent FEPAL since 2016. She's also a founder and director of the PsychoAvance private practice since 1981 and has practiced 40 years as a child, adolescent, and adult psychoanalyst. She is also a professor, lecturer, and author of book chapters. So please, Olga, please go ahead.
Okay, thank you so much, Monica, and thank you, IPA, for this special space we have today. I'm going to talk about turbulence in a generation crossed by COVID-19, global digital minds, a psychoanalytic challenge. And I do emphasize the word turbulence. I think most of us have been working with young adults during many years, but this past 2 years, crossed by the pandemic, we have had to face new challenges. I shall start with the surface, that is the reality principle, COVID-19, that left us with no escape to encounter many ruptures, deaths, losses, traumatic situations in a human, social, educational, cultural, and even economic structures, plus a significant elevation in the use of technology, for good and for bad. Our everyday life has been turned upside down, and life as we once knew it is in desperate need to be rearranged, as well as some aspects of our analytic practice as well. On top of that, the underlying psychopathology is more exposed than the pre-existing pre-morbid personality before the pandemic. I have to remember here Masood Khan, 1971. He taught us about the cumulative trauma, that repetition of small traumas that interfere with the functioning of the ego in infancy or adolescence. Traumas that are resignified, rupture upon more ruptures, and not by choice, not by subjectivational freedom. So I think that each generation has had psychic cultural transformations and has been named after them. For example, the silent generation that was immersed in the war context, that was 1925 to 1944. Then came the baby boomers. I belong to the baby boomers. That is the product of post-war and its vicissitudes. For example, the rise of natality. That was 1945 to 1964. Generation X, 1965 to 1984, were those who saw the birth of the internet that acknowledged the presence of women in the working, political, educational, and business worlds. Then the Generation Y, 1985 to 2004, that was crossed by the millennium, the so-called millennials, and they only conceived the world on the fast track, the fast food, less willing to make efforts and demanding well-paid jobs. Everything had to be done at this very moment. No frustration was easily tolerated, and technology has had a central place in their everyday life. Traditions and family gatherings become undervalued. Then finally, we come to Generation Z, 2005 to 2024, now crossed by the COVID-19. So we have also named them pandemials, or I use another name, Zoomers, that is not baby boomers, but Zoomers. And they are 100% digital, living in a globalized world, less expression of affects, less importance to human relationships and attachments. They have the we work, co-living ways of life, more need of sensorial, visual, and auditory stimulus. They connect via digital platforms without knowing each other, mainly to obtain pseudo gratification with explosions of dopamine, and they could act very self-centered, less resilient to frustrations in a world where violence is present in every game, every movie, as well as in real life. So I do think that the world we knew has been transformed, and we too, as psychoanalysts, need to inhabit it, and we need a new version, and most of all, with hope. There is a Japanese term now spread in Europe and America related to an addiction of screens and virtual media, strongly emphasized during the pandemic. It has to do with extreme lockdown and avoidant behavior. It is the so-called hikikomori. It is a disorder characterized by an asocial avoidant behavior, isolation, and compulsive immersion in the digital world that is linked to culture. This disorder leads to abandonment of society and literally stepping out of the subjective scene. Any type of attachment or non-digital communication is rejected, and life revolves around the use of screens, video games, digital networking, and sometimes hours of pornography that debase sexuality with a real partner. That is the everyday bread. In a nutshell, I would say don't think, don't feel, don't talk, no working through losses, no mourning, don't duel any type of affect. If a loss is not literally inhabited by sorrow or lived and felt, it is not only denied, but it is splitted until it will return in disguise. So new technologies have invaded our society for good and or for bad, making it difficult for us to discern between abnormal behavior and the onset of a new array of disorders. On the other hand, a different mode of learning, also in the fast track. Creativity maybe even sublimation in a way we don't quite understand yet. So I think that the hikikomoris may well be a parallel situation to Andre Green's so-called white depression, where they egosyntonic to an era very similar to what Zygmunt Bauman's liquid individual in a liquid society, something like an anti-subjective mode of existence with non-bonds, everyone is replaceable. There is an issue of intimacy versus void, the cathodic deprivation in a digital world to the extreme of becoming robotized with a dead self, something like the dead mother, but a dead self, sounds hopeless. But we analysts have been called by Generation Z to a new understanding of our times, a new way of relating and intuitive listening, being able to touch the non-suffering services with a profound unfelt mental pain that lies underneath. It is our immediate challenge. Facing the generation gap is a must. Like Ferenczi's well-known paper, The Unwelcome Child, we need not to fall in the abysm of the unwelcome patient. If there, even Sumru's paper, I would say the unwelcome candidate, we have to be aware of that. If there ever was a wish to be numb, not to feel or to feel something different, body sensations somewhere along the way, the wish to psychic rebirth must also have been present. I was once told by an adolescent with self-harm cutting, people worry if I cut myself. They don't understand they should rather worry that day I stop cutting myself, because that day I will probably kill myself. Cutting herself was a way of keeping herself alive, like many other endangered parts of the self, in screens or other common addictions of our era. On the other hand, there is a counterpart where Christopher Bollas talked about the normotic personality that consists of being abnormally normal, meaning those individuals that are perfectly functional, but their subjective world is also non-existent. The normotic affection is for Bollas the illness of inexistence or paralysis of the self, the anti-subject belonging to another version of the Greenian so-called white depression. New forms of suffering and their underlying pathology, like René Roussillon's concept of identitary narcissistic suffering that expands the classic borderline personality, and the inclusion of the word suffering that demands a flexible analytic listening and connection with our young patients, more focused on reading the body, the verbally unexpressed, and what he called messenger acts. Just there where traumatic experiences are not symbolized, where they remain splitted from that part of the ego, adjusted to the reality principle, and they return not in the classical way of repressed material, but splitted with repetition compulsion and a huge void. So we have acting outs, psychosomatic symptoms, panic attacks, addictions. According to Roussillon, the analyst reconstructs, or better said, co-constructs the subjective experience, not subjectivized, that invades the perceptive present of our young patients. Like Thomas Ogden's analytic third, that special and unique mutual space co-constructed between analyst and patient that creates an unrepeatable and intersubjective transracial zone. Finally, I shall go to the good stuff, like Simon Actors mentioned in his book, talking about resilience, gratitude, and courage. I think that our patients are not Freud's patients. So we are immersed in cultural and psychic wrappings and ruptures, and we are urged to cope, to understand the new everything, new language, new ways of relating, new idols, new ways of playing, even new Netflix series. In our personal ways, we analysts also fill our days with electronic stimuli, our cell phone, computers, even social media that have become a part of our everyday life. They are also transformational objects. In the fast-track world where change is permanently changing, listening is more than complaining of the difficulties in analyzing the new population. It has been complicated. Young people's attention has shortened, but managing to speak the same language, or in Bolas's word, the same idiom, also helps connect and makes reflection possible. I have been surprised at unexpected creativity and a different quality of learning and vocational choices that have also changed, and many for the better. When I was told by a patient that has a passion for the universe about other planets, he said he was willing to work in a hotel that would be the world's first space hotel in 2027. And he showed me the printed material where this hotel is going to open. So it is no longer science fiction. And with another patient, 12 years old, I used the word Zoomers at the beginning of a session, and he laughed. And he tried to explain to me that Zoom is dead, that Facebook is no longer in use, and that WhatsApp will soon disappear. The new stuff is the metaverse. He explained how he would virtually walk into my consulting room with his 3D VR glasses. He would sit in his usual chair, making the therapeutic session a much more real experience than the two-dimensional Zoom we are using. In fact, he can make an avatar of himself and maybe create another one for another session. How should we call those avatars? Ideal selves, fragmentation of the personality, identity diffusion, or a way of experiences in empathy, different situations? This is where so many questions arose in my mind. Maybe we will even literally and virtually walk with our patients through their dreams. So I realized that Generation Alpha is around the corner. Those born between 2010 on. So if we could ask Generation Z, what do they really want? The most educated guess would be to start all over again, a genuine rebirth. Parents that are not hyper-busy, a world of hope, metaphorically a restart of the alphabet, the alpha generation that is already stepping ahead with the metaverse and creating their own avatars, a sort of ego ideal, a mix of the real and imagined, either splitted or maybe integrated. That is the big question. Imagining a world where they could be anyone at any time, where race, gender, sexual preference, or physical ability does not matter, where you could be yourself without fear or intimidation. Could a world like this really exist? A place without fear of discrimination, like a sort of safe heaven with an unconditional sense of belonging? Mercer and Red Thread 2019, in a recent study of avatar environments, simulate the real world using role-playing. For example, making preteens and teens experience bullying in a schoolyard, making them think twice before bullying someone because they have already experienced it, or avoiding drugs after experiencing withdrawal symptoms. This also favors inclusion of gender, race, and cultural differences. In the virtual and the real, in this sense, a splitting mechanism? Is this detachment from reality, or is it an integrating one, or a bridge that may help a young sufferer achieve more connection with another empathic person? Generation Alpha will be parented by millennials, as Generation Z was parented by the Y generation that saw the birth of internet and couldn't get enough. Also unable to fill the glass of buying material goods online, neglecting significant bonds, looking outwards more than paying attention to the inner world. And here, implications of parenting do their work in these cultural transformations, given that we know that early years live in many ways as object-seeking adult years. What is said characterizes Generation Alpha in a nutshell. They will be the most educated generation in history. They are tech-savvy. A is the reality. A is Alexa, Series, etc. Their learning is highly personalized. Social media will be their dominant mode of interaction. They do not like sharing economy, and they don't play by the rules. Another important thing is that religion goes out of the window. Here comes another question that maybe we don't like to hear, but will psychoanalysis for these generations also go out of the window? Or may we keep the basics and learn to listen and cope with these new generations? In a sense, everything has changed, but in another sense, there is nothing new under the sun, only new versions of human psychic and nature. I want to quote Balint, Michael Balint's concept of new beginnings in 1952, when he wrote, quote, "The final aim of this therapy is to convert regression into rebirth and regrowth. This must result from the regressed ego, finding for the first time an object relationship of understanding, acceptance, and safeguarding of its rights with a therapist who does not seek to force on the patient his preconceived views of what must be done, but who realizes that deep down, the patient knows his own business first. We can understand his language." And then he goes on and on. So I must conclude with a very strong caveat, and that is our task as psychoanalysts to understand the generational language, the idiom, the body, and not only in words, the messenger acts, the longings and desires, the new technological scenarios, and cope holding on to the basic rule with Freud, but after Freud. And like Winnicott taught us, without being dogmatic or rigid, letting Generation Z patients use us as evocative, survival, and transformational objects. So thank you for listening today.
Oh, thank you. Thank you very much to the three of you. So I now open the discussion, and of course, please, I ask the participant to participate with their questions. You can write them in the question pane, as I said before. But I want to start this discussion with the question, a question I had in mind while listening to you. Well, you talked about the creation of the external world and about the auxiliary ego that needs the auxiliary ego or the parental auxiliary ego to be functional for the development of the adolescent. And finally, Olga also talked about the bridge and the importance of learning the language of each generation. So this made me think about the virtual as a possible transitional space. No, so the technical aspects that you talk about might be more human if we can think about them as a playground, a sort of playground in which we can also take part to stay with our patients and to talk about these aspects with them. I was also thinking about the words of Laura Ambrosiano. She gave a very nice lecture about these topics and talked about the oscillations between undifferentiated, which is what we talked about today, no? The undifferentiated world where avatars are present and you can be everything you want, and you do not have a subjectivation actually in that kind of sort of way of being, no? And the differentiated. So maybe the problem that you are talking about, the new sufferings are happening when a stall, a deadlock of this oscillation intervene, and the adolescent is stuck in this undifferentiated world, in an undifferentiated state of mind. That's a question I do not know if it's for Darius, Somro, or Olga. Maybe it's for the three of you. So how the psychoanalyst, well, this is a big question actually, but maybe the work of a psychoanalyst is to transform this virtual world in a transitional area in some cases when this stall now is present. So
yes, absolutely. I would say I think what's really important is what I try to explain in terms of they don't know what they're doing. Actually, it's outside their awareness. It's unconscious that they are used to creating everything the way they like, but then they're expecting the same thing when they launch into the adult world, which inherently poses some limitations. Becoming aware of this dynamic that they grew up with, and understandably they're trying to create similar experiences for themselves, helps a lot. So they becoming aware of this in analytic treatment, I think, is important. And then I think it's going to be some kind of integration where it's not going to be, adult life is not going to be as easy, as unlimited as what they were used to, but there are still ways they can be creative and they can create the kind of life they want. So that's the work, part of the work, in my understanding.
Yes, well, I think that we need to work as transformational objects, and you know, with that concept, and like Winnicott mentioned, with the use of the object, we need to let the patient use us, and we need to contain them, but we do need to listen differently. We do need to understand what they're talking about, and you know, I am really afraid, because I have heard between colleagues something like the unwelcome patient I mentioned, something like it is so hard to work with these young people that they want fast results. They want like in a PowerPoint telling them what to do specifically. And in a sense, we may lose that they are really suffering either with this narcissistic identitary suffering, where it seems that they are not suffering with a white depression, but they are really suffering. You know, there is this void where they are disconnected, and we need to be that bridge that helps them and construct with them. No, I think we have great challenges in the way in keeping psychoanalysis basics, but we need to cope and to adapt what these young generations are in need for.
I think that Monica, what you was talking about this creation of maybe I tell it, I think that we need to know better the virtual world of our patients. I think that for me, in my practice, it was not easy, because I also belong to Generation X, and I use a lot of computer, cell phones, and all the equipment in my work and everyday leisure activities. But I'm not very competent. I don't spend much time on it, and I feel it was quite difficult to understand even my Generation Z patients when they speak about their virtual world.
Mm-hmm.
But I think it is very important for me if I want to understand the internal world of this patient.
Exactly.
Because I think that it's very much reflected in how they live, how they use this virtual world. Even.
Mm-hmm. How? Mm-hmm.
Yeah.
The how.
So
Yes, I agree.
Mm.
If we do not understand the outside world, it is very difficult to connect with the inner world.
Yeah.
I think what Olga was saying a minute ago, Olga, you were saying we need to keep to the basics of psychoanalysis, but also adapt to them. Absolutely, and I see this as not changing psychoanalytic methods, but expanding the focus of psychoanalysis, because where we lose the fact that what they're experiencing is valid because of how they grew up, then we lose the patient.
Exactly.
So that's why it's really important to have this empathy and also keep this in mind, but bring our psychoanalytic perspectives also. It's not, we don't have to put them aside. And one thing in my experience working extensively with millennials is that they're open to that new knowledge also. They're not closed, they're open. That openness is also part of how they grew up.
And we need not to be our preconceived theories, you know, they won't help. And if we are very dogmatic, we are not expanding, like you say, Sumru.
Okay, so I will go through the questions from the public, from the participants. So the first one is this. Has political correctness become a sort of tyranny? What do you think of a less binary world, especially regarding the Oedipus complex? I don't know, this might be for whom wants to answer. And then I will go through another question that came now. So you can reply to all of them later. So I want to compliment Sumru on your paper. What an important perspective to share. I am a millennial psychologist undergoing my psychoanalytic training for some years now, and in your descriptions matches my experience perfectly. I exchange with other millennial colleagues whom experience the same, but mostly keep silent in order to not come across as difficult, rebel, antisocial, or even being pathologized. Experiences that I have helped, I have seen happen or suffered by myself. I also exchange a lot with elders in our field, since I'm privileged in my access to our society, and a great part of them seem to not have any idea of what I'm talking about. I found out that some, perhaps most Lacanian schools have a better capacity to give such space to student candidates. They don't name as candidates, which I believe already gives a clue about that space. I felt along the years that I had to change my understanding of my teachers and have a better notion of their own true and legitimate fragilities. It costs more silencing from my part, but I found I can still explore my own ideas without making my teachers feel too threatened by them. So this is a much more of a comment. Maybe someone can say something afterwards. And then another question. Here it is. Really appreciative of such engaging and elaborative representations. I would like to address the subject of Generation Z's language in analysis in terms of free associations, and moreover, difficulty in expressing the patients expressing themselves due to them opting for a seemingly less expressive and effective forms of existence. And any thoughts would be welcome. So I will stop here if you want to say something about these questions.
I can start with the first question. Maybe it was about the is political correctness tyranny. A little bit provoking question, I think, and I would answer maybe not about the political correctness itself, but maybe about the tyranny of ever-present superego, with I think living in virtual reality, at least Generation Z, they experience more paranoid fears, being all observed, being persecuted by all this virtual environment of others, seeing you, watching you, and maybe this can be related to this experiencing a kind of being in a tyranny. So that's my opinion.
Let me take this second question, which was a comment. Do you have the name of the person?
Yes, she.
Just one.
Yeah, sorry, I need some time to find it because Mariano Rupert sent it to me. No, Isabella Nick.
Okay, Isabel, I totally know, I understand. What I'm going to say, first of all, thank you for your comment. Don't give up. And this is not even about age. As you may have noticed, I included a very senior analyst's quote, her letter to her first analytics supervisor, Sandra Buchler. So there are people who will understand this experience and who will be open, even in the older generations. So find those supervisors who will be a much better fit for you. And I wish you best of luck.
And maybe I would like to mention, and it's not really answering the question, but there is such a fine line between pathologizing something or normalizing something. Because, you know, also with maybe some things are politically correct, but sometimes there is pathology. And sometimes people are tending to normalize certain situations, or we have this kind of false self of normotic personalities, and they do have this inside suffering that is not manifested. So there is a fine line that we need to really connect with that inner world. And if there is pathology, well, we shall work on it. But between being pathologized or normalized in excess, we have to be careful.
Mm-hmm. Okay, so now I will read you two other questions. Any thoughts advantages and disadvantages of doing therapy remotely with patients of this generation? This is the first question. And then another one which is quite linked. What is your opinion about rethinking a new setting of psychotherapy? Would add also thinking about Olga's presentation about ikikomori, because these patients are particularly difficult to reach. So, well, I will stop here and read you more if we have time later.
Yes, I think the pandemic has made some young people get very, very isolated. Of course, this hikikomori started in Japan many years ago, before the pandemic. They are very difficult to reach, and they get very, very addicted because they have these huge explosions of dopamine, with the screens. I had a patient that's why I mentioned pornography, because hours of pornography, and then there is no way it debases the real sexuality with a real person. So the first thing we have to do is try to connect him with himself. And sometimes they are not aware of their history. They don't remember anything from their childhood. So the first thing I think we need to do is, I don't know if the word in English is historicize the patient, but make them inhabit their history and remember, and I go from there on.
I think about the question on the online treatment. I think all of us had experienced this during the lockdowns related to COVID infection. And in my personal experience, something was unexpected. With the regulations which were implemented in my country in the middle of the spring last year, I simply was not able to continue treatment face-to-face. So I had to offer all my patients this possibility to continue treatment online. And I expected that my adolescent patients will accept it very easily. That they would be this part of my patients which will be excited with this possibility. But it didn't happen like this, at least in my practice, that some of them, and I think that those who had social incompetency, social phobias, they were the ones who were not accepting this possibility easily, and they needed more time, or we had to make some month break during those the most acute period of lockdown. And with others, at least my patients, they were very eager to come back. Adolescent patients were. So I think they value very much this real connectedness, and they see it as important alternative, I think, for their online relatedness to their peers and to this virtual community. So my experience was like that.
I just want to quickly add, you know, history of psychoanalysis is full of examples of the field resisting to something new, saying that's not analysis, that's not kosher, orthodox, but then over time accepting that more flexible option. So I think every time we resist, we're shortchanging our patients. We need to be flexible, but that doesn't mean we need to be, we shouldn't think about it, because what we have needs to be preserved to a certain extent because there's good in it. So I think we can try and still be thoughtful about it. One of my patients, for example, after we moved to online during the pandemic, after a while, I asked him, how is this compared to in person? He said, I actually didn't want to do it at the beginning. It felt like it was going to be difficult. But now that I look back, I made so many breakthroughs working this way. It is working, he said. So we wouldn't have given it a chance if we said, no, this won't work. Another thing I want to mention very quickly on remote therapy, one of the experts on remote therapy is Dr. Todd Essick. He writes and publishes on this topic, and in essence concludes that there are gains and losses in both options. So I want to recommend his papers.
Well, myself, I have been very comfortable working online, even though I shall always prefer in person. But we have found a way, and I think that patients that are already in transference, it's much easier to continue online because there is this previous, it's like something that you continue. Maybe it is different with new patients that see you for the first time. You do lose a lot of, you know, the body language, the pulsion, the drives. One of my patients said, I cry differently because when I cry on the screen, I tend to take my face off the screen so you don't see me. And in person, I feel more comfortable crying. And I will always prefer in person, but I have found that we can do it online, and I do feel comfortable. And when it is analysis, psychoanalysis, and not psychotherapy, I think it's very useful to turn the camera on at the beginning and at the end, you know, when you greet the patient and before they go, and that gives a little bit of bonding, no?
I think we had lost one question about the language of Generation Z and about their language in communication and in free associating. And I think that Generation Z, again, in my country, they speak a language which is a mixture between Lithuanian language and English language. And sometimes, especially when they talk about some emotional issues, emotionally involving issues, they feel short of words. And then they start shifting between Lithuanian and English language. And I think this is related to this part of their life spent in internet, where they communicate mostly in English, and it makes this kind of problem for finding the right words for expressing themselves in one language. They're not so so good now in Lithuanian, but they are not also as good in English. And yeah.
There's so many things about language. I think we can also use language in a playful way. There is a way of having our special language with some patients. I had a young patient that was very annoyed every time I ended the session, and she started calling me the Big Ben. And so I would play with this word, and I said, "Here comes the Big Ben," or I would say "doing, doing." But you know, sometimes we have this language in common. And another thing with the young generations, when they feel free to use bad language, or you know, some words that we don't need to use them back, but we can tolerate them speaking the way they want to speak. I think that's important. They feel accepted, or they can be themselves with the way they want to speak.
Okay, Sumru, you don't want to say anything about this? We can. You want to add something?
I think I agree with what Darius and Olga said.
Okay, then thank you very much to our three panelists, Darius Leskauska, Sumru Tufek-Çoglu, and Olga Santamaria. Thank you very much for your papers, for your presentation, for the discussion, for the time you spent with us. And thanks to all the participants to be with us until now. I think it's a very engaging and very interesting topic, and we will need to talk more about this. So please, as you can see on your screen, we made a group discussion on LinkedIn, and you will find the link to this group discussion on your email. We have just sent with the link to the webinar. If you want to keep on discussing with us, of course, the panelists, our authors are invited to take part in this discussion. You are all welcome. So please look in your emails, and you can join the group and start talking about this. So I want also to present the next webinar that will take place on the February 25th, and the title, as you can see, is "Pleasure Still a Key Concept for Psychoanalysis: Theoretical Clinical Perspectives of Our Practice." So thank you all for staying with us, and see you in the next webinar. Thank you. Thank you.
Thank you. Bye-bye.
Bye-bye.
Bye, everyone.
Thank you.